right. Hi, everyone. This is Elizabeth Bioteau with the Rhode Island Continuum of Care, and I am here today with Amy Ferguson from the Rhode Island Coalition for the Homeless, and we are going to spend a few minutes walking you through some resources that she and I have put together in the last few days to help you as outreach and shelter staff in the Rhode Island Continuum of Care respond to this COVID crisis and accurately screen your clients for COVID symptoms. So before we get started looking at the actual tools, I'm going to give you a little bit of context. I want to let you know that on March 16th, Rhode Island convened what we're calling our COVID homeless response team. And we convened cross-sector leadership positioned to take rapid action to ensure that our community has a coordinated and statewide effort responding to this unprecedented COVID crisis. Rhode Island is lucky that we do have the benefit of learning from some other communities that experienced their COVID surge ahead of ours. And so we wanted to capitalize on that opportunity and make sure we get you the resources as quickly as possible to respond in your shelters and in the encampments around Rhode Island. So our response team was supported also by HUD technical assistance, and we were lucky to have leadership from the Center of Disease Control. So we want you to understand that this guidance that we're giving you today is supported by Rhode Island Department of Health and the CDC and is in line with their current practices on COVID. Okay, what you're seeing now is a description of who is on our homeless response team. So we have leadership from the Department of Administration, Behavioral Health, Department of Health, Department of Human Services, the Rhode Island Coalition for the Homeless, the Rhode Island Continuum of Care, the United Way, the Office of Veteran Affairs, the Rhode Island National Guard, Rhode Island Emergency Management, and the City of Providence. So I've already said a little bit of this, but just to restate it, our goal with this training is to help you know and understand the screening protocols that the CDC and the Department of Health think are best position the clients experiencing homelessness getting access to COVID screening if they need it. This is to keep both you as our staff and the residents that you are working with safe. We have tried to create these tools to be as user-friendly as possible. So as Amy's walking you through the tools, she will give you more examples, but in a lot of parts of the tool, we've designed them to be a script that you can just use. We know there's a lot going on right now, and we hope that this feels like support to you as you're working during these next few weeks and months. Okay, Amy, with that, I'm going to turn it over to you and you can start talking about the screening tool we've designed.
Awesome. Thank you, Elizabeth. So a reminder, this is Amy Ferguson with the Rhode Island Coalition for the Homeless. We're going to walk you through the screening tool that we've developed. And after the presentation, the screening tool itself will be shared with you. But all these screenshots are from the actual tool that we've developed for you. So the first thing on the screening tool is a quick guide to help you understand and differentiate COVID symptoms from flu and allergy symptoms. So a friendly reminder, the COVID symptoms are fever, cough, and shortness of breath. Those are the three things that we need to primarily be looking for. If someone does present to your shelter or you find them on street outreach or in any other sort of a frontline staffing setting and there are severe COVID symptoms, do not go through the screening tool. Call 911 immediately. Those symptoms include extreme difficult breathing, including not being able to speak without gasping for air, bluish lips or face, persistent pain or pressure in the chest, severe persistent dizziness or lightheadedness, new confusion or inability to arouse, and new seizures that won't stop. The screening questionnaire, we understand it looks small on your screen right now. Don't worry when it's presented to you in the final format. The text is much bigger, so don't strain your eyeballs to read this right now. We've created this tool for you guys to read verbatim. So start at the top. It says to keep folks healthy and connect people to care they need. We will be asking everyone these questions. In question 1, it says, do you have a fever, yes or no? When your shelter has access to a thermometer, please take their temperature if they say yes. We understand that you don't all have thermometers or don't have access to give everyone a thermometer test, but when you do, please do take their temperature. And a fever is considered a temperature over 100.4 degrees. As you continue on in the screening tool, you'll notice that there are instructions to isolate, give face masks if available, and contact PCP or the Rhode Island Department of Health. When you get to question 2, if question 2 is yes and question 1 was yes, you do not need to finish the screening tool. You can stop the screening tool, contact the PCP or the Department of Health, and move on. What else do I have to tell you about this one? If someone answers no to all of these questions, they can safely enter shelter. If someone answers yes to only one of these questions, they can safely enter shelter and to be monitored. The screening will depict very clearly what your steps are supposed to be and when you are supposed to contact the Department of Health. So please just continue to read it verbatim, and there'll be a clear understanding of what should come next. If additional screening is needed, so if someone has answered yes to multiple questions that you'll understand in the workflow as you're going through it, follow this section of the screening tool to understand how the process would differentiate for someone who does have a primary care physician or for someone who does not have a primary care physician. When you are contacting the primary care physician or the Department of Health for additional screening, please be sure not to use jargon. It's not very likely that the person on the receiving end of the call will understand that a manual means a manual house shelter. So you'll see where things are bolded and underlined. It says, is homeless and in a congregate shelter setting. We want you to be using that language to then trigger the appropriate response, which is the Department of Health and the primary care physician, understanding that this is a priority population and they need to be given a test with further instruction and guidance. This next slide is really just for you guys to understand what happens next. This isn't any action that you have to take, but for you to understand once your client gets transported for testing, what happens. You are not responsible to do any of these things. We just want to give you the bigger picture. We also want to give you the information to advocate if you are struggling with any part of this process.
Okay, thank you, Amy. So Amy just finished walking you through the screening tool. As she said at the beginning of her part of the presentation, we are going to be providing you that screening tool after this training. What we're also going to provide to you after this training are 2 workflows. This one you're looking at right now is the workflow for shelter, and the next slide is going to be a very similar looking workflow for the outreach community to use. This slightly complicated looking workflow is supposed to be helpful and help you walk through the step-by-step process of what Amy just described on the screening tool. So I know the first time I looked at this, I was a little confused by the color codes. So I'm just going to take a second to explain them to you. The red points, the red boxes on the screen, on the pathway, are the end points of this particular pathway. The green parts are if your client has a primary care physician, and the yellow parts are if your client does not have a primary care physician and then is going to be contacting you are going to be contacting Department of Health to support them. So the blue are questions you do with everybody. So I'm not going to walk you through step by step what Amy just explained to you very well, but I do want to just point out that a couple of things. One, we think this will be a helpful resource for shelters and outreach teams. So the coalition has already agreed to print and provide laminated copies, and we appreciate their support with that. The other thing I want to tell you is we are all human and there is a lot going on right now. And so it is very possible that this protocol may break down, and we want to let you know what to do if someone that you are trying to work with on this pathway is not responding the correct way. So for example, we have had some trouble so far when shelter staff are contacting DOH or a PCP to arrange for transportation to testing. We want to call your attention to the Department of Health phone number on the bottom left of this pathway. And if you encounter any problems with following this step-by-step procedure in your shelters or in your outreach teams, please call the Department of Health. And our point of contact there is Deb Garneau, and report the problem there. That will help us make sure that while we're all working hard to kind of build this boat as we're sailing it, we can get you the resources you need to take care of yourselves and the clients that you're working with. So just to be super clear, if you run into problems as you're working along this pathway, please call the Department of Health number that's at the bottom of the icon, 401-222-2577. Like I said, this is a similar looking workflow that should apply for our outreach teams. So I'm not going to walk you through the step-by-step part of this pathway, but I do want to point out that the color coding is the same. So the blue boxes are what you're going to do with everyone. The green boxes are for clients with a primary care physician or a PCP. The yellow boxes are for clients who do not have a PCP, and so you need to connect them with the Department of Health for their supports. And the red boxes are the endpoints of the pathways.
And last slide to review with you. At the Rhode Island Coalition for the Homeless, we're keeping a tremendous amount of information and updates on our website. So please do check out our website for updates about meal sites, hygiene, and hand washing stations, minutes from our calls, helpful links, you name it, it's all on there. Additionally, I want to invite you to participate in our daily COVID homeless response call that happens every day at 3 p.m. If you are not currently receiving those calendar invites or follow-up emails with all of the call notes and the resources, please feel free to email me at amy, A-M-Y, at rihomeless.org so we can get you on that list.
Okay, and last but not least, we just wanted to take a moment to say thank you. Thank you for your time today, and thank you for all the hard work you're doing. These are unprecedented times, and everyone, including you and your clients, are balancing more than any of us probably ever thought was possible. So I just want to take a minute and tell you how much I appreciate your continued work in the outreach teams and the shelters around our state. So thank you very much, and be well, everyone.